Many people vow to exercise more at the beginning of the year, but it's easy to abandon those good intentions. A way to avoid that? Set some clear and attainable goals. Here to talk to us about how to start an exercise routine is Dr. Doug Connor, a sports medicine physician, and Emily Murray, a physical therapist, both with ThedaCare Orthopedic Care. Thank you for joining us.
Happy to be here. Thank you.
Wonderful. So we're going to first talk about the exercise routines that people can start at the beginning of the year, maybe how to stick with those exercise routines, and how to stay safe, because that's, again, all really important topics, right?
Yes.
Absolutely.
Perfect. Okay, so let's dive into it. Why is it so important to have an exercise routine? Dr. Connor, why don't you start for us?
Sure. And I guess it's hard to count the innumerable ways that exercise is important for our health. There are a number of medical conditions that exercise has proven to be better than any pill we can give somebody. People who exercise are found to be, have longer lives, have better quality of life. It's not just to be active, but it's really for your overall well-being.
So we often hear about this recommendation to get at least 150 minutes a week of physical activity. Do you want to start, Dr. Connor, maybe talk about why that's important, and then you can come alongside and maybe talk about what you do for 150 minutes. How about that?
Yeah.
All right, Dr. Connor.
So I guess when I start talking with patients, I throw away the number. You don't need a certain number. Those are guidelines that are recommended by a number of well-being societies, and overall, we do see numerous health benefits at that level, but everybody's different. So when someone comes into my office, we often talk about exercise as medicine. And we actually talk about an exercise prescription that I'll give somebody at the office visit. And so that has to start with the individual. So every person's different. I don't want people to get hung up on a minute per week that they have to do. But if we can start getting you moving, we know that physical inactivity is such a problem. And so getting you moving, sit less, move more, let's start there. And then we'll figure out kind of what goals are in terms of, the intensity of exercise, the duration of exercise, what exercise you're doing. But that's kind of a secondary thing in my mind.
Okay, and Emily, do you want to talk a little bit about when people think about maybe those recommended minutes or starting an exercise routine, it may seem overwhelming for some people. For busy parents, for busy adults, we just can't find time to fit it in. Do you have any type of advice for when we can fit it in?
Absolutely. So schedule exercise into your day. Make exercise part of your lifestyle. Do what you can, when you can, with the time and resources available to you. A short workout is better than no workout at all. It still benefits us. It helps us to maintain the habit of regular physical activity, and even more powerful, it helps us to maintain the habit of taking care of ourselves, which is the best thing that we can do for us and the people in our lives.
Okay, that's really good advice. So let's talk now about staying safe and steering clear of injuries, because a lot of people, beginning of the year, they're starting these exercise routines for the very first time. I want you both to talk about, how do you stay safe and what do you recommend to people?
Yeah, absolutely. So the first thing is when you're exercising, you want to make sure that you're taking the time to perform up and a warm up and a cool down. So a few minutes of walking, maybe some dynamic exercises just to increase the blood flow to your muscles and joints and prepare them for activity. With a cool down, you want to gradually decrease the intensity of exercise that you're performing and then follow that up with some static stretching. In addition to that, as you're exercising, you want to gradually increase, once again, the exercise intensity and incorporate a variety of different activities. I talked about previously incorporating things like aerobic exercise, strength, flexibility, balance to really address all aspects of physical fitness. And you also want to switch up the exercises that you are performing to challenge your body differently and prevent any overuse injuries. In addition to that, rest is so important. We want to make sure that we're incorporating 1 to 2 rest days to give our body optimal times to recover. And also listen to your body. If you are experiencing pain, don't push past the point of pain. You want to make sure that you talk to your doctor, get some help, or maybe even schedule a consultation with a physical therapist.
That's wonderful. Really good points, Dr. Connor. Other things to avoid injury?
I love the pushing through pain part, right? I get a lot of weekend warriors in my clinic, and we've always been told no pain, no gain, which is not the way to approach, especially initiating an exercise routine. If I was somebody who's been exercising for years and runs half marathons on weekends, yes, that patient is going to have a much higher level of activity that they can tolerate. If I have somebody who has not been active for even a few years, you've got to start slow. Exercise shouldn't be painful. You should not be pushing through pain. I often talk about patients being able to finish their exercise routine feel like they could do more, but stopping because this is more than what I did last week or the week before. And so this slow, steady progression of having an end goal in mind of where you want to be, but having a plan to get there.
All right, thank you both for being with us. We appreciate all the great advice you've given us.
Thank you so
Thank you.
much.